You're watching Wisconsin Eye, an independent, nonprofit public affairs network, engaging the citizens of Wisconsin since 2007 through access to government proceedings and public policy events.
Joining us for today's briefing are Governor Tony Evers, DHS Deputy Secretary Julie Willems Van Dijk, and available to answer questions are Dr. Ryan Westergaard, Chief Medical Officer in the Bureau of Communicable Diseases, and Ryan Nilsestuen, Chief Legal Counsel in the Office of the Governor. We'll begin with remarks from Governor Tony Evers.
Good afternoon, and thank you for joining us today. Folks, it's been a bit of time since I sat at this table together with all of you, and frankly, I hoped we wouldn't be back. But unfortunately, we are back again today because we are seeing a concerning, steady increase in COVID-19 cases here in Wisconsin. As of earlier this week, the 7-day average of new confirmed cases has increased 40% over the past week, and it is 11 times higher than it was a month ago. All 72 counties are experiencing high or very high disease activity, and our healthcare providers are preparing for the worst. Folks, this Delta variant is no joke. It is highly infectious and is spreading more quickly than any other strain of the virus. We are no longer in the fight against COVID-19. This is now a fight against the Delta variant and all the potential variants that could follow. But Wisconsin, there is great news here, and that is that we have the answer. The answer is simple. Get vaccinated. The The vaccine is safe and effective, and getting vaccinated is the best way to protect yourself, your family, and your community from COVID-19 and the Delta variant. It's easy, it's free, and anyone can get the vaccine regardless of immigration status or if you've had COVID before. So far in Wisconsin, more than 245,000 doses of the Johnson & Johnson have been administered, more than 2.3 million doses of Moderna, and more than 3.2 million of Pfizer. All in all, that's more than 5.8 million doses of the vaccine, with nearly 3 million individuals completing their vaccine series, most with only minimal side effects. That's about 3 million of your friends, family, coworkers, and neighbors who are rolling up their sleeves and getting vaccinated to help protect not only their families and friends, but to help protect you too. And that's including more than 300 Wisconsinites that have gotten their vaccine and a free cream puff at the state fair. And folks, it's really that simple. While the state fair ends soon, and so do the cream puffs, there are still plenty of options to get your vaccine. Whether it's in your doctor's office, your local pharmacy, a pop-up clinic at work, or a community event, do not wait. Vaccines can and will save lives. So head to vaccines.gov and find your shot today. And take a friend or a loved one with you to get theirs. In fact, getting your vaccine isn't just good for you, but it's critical to ensuring our state continues to rebound and recover. In Wisconsin, we are recovering. We're all enjoying more time getting back to things we love with people we love. Our small businesses and tourism attractions are welcoming visitors back, and our workers are getting back to work. In fact, our unemployment level is back to nearly pre-pandemic levels. This recovery has been in large part thanks to all of you and your work to get vaccinated and stop the spread. But it's also part of our strategic investments with our American Rescue Plan Act dollars. Just this week, we're glad to announce more than $70 million of our American Rescue Plan Act funds went out the door to more than 880 lodging businesses around the state to help provide a shot in the arm to an industry that really needs it. And today we announced about $50 million in grants went out to 115 out-of-school providers and nonprofit organizations to help our kids thrive beyond the classroom, from additional learning opportunities to mental health support. And we will continue to get these funds out the door as quickly as possible to the folks who need it, from our farmers to small businesses, our schools, and our local communities. Folks, our state and our people are resilient, but it's going to take all of us working together to get this done. So let's roll up our sleeves, let's get vaccinated, and let's come out of this stronger on the other side. So with that, I will now hand things over to Deputy Secretary Julie Willems Van Dijk. Take it away, Julie.
Thank you, Governor Evers. In our state, 5,970,124 doses of COVID-19 vaccine have been administered to date. 2,906,588 Wisconsin residents have completed their vaccine series. We are also adding 1,460 new cases today, which brings our total confirmed cases of COVID-19 to 634,495. Our 7-day average of cases is 1,104, double where we were 2 weeks ago and 11 times where we were 1 month ago. We are clearly seeing a surge in cases. Today, we are also reporting that 4 more Wisconsinites have lost their life to COVID-19, which brings our total deaths to 7,466. Our thoughts are with the families and friends who have lost loved ones throughout this pandemic. Over the last 18 months, we have been committed to keeping you well informed so you can make safe decisions about your health and the health of your families and communities. So today, I want to help you understand the surge that we have entered by discussing the Delta variant and what you can do to protect yourself and your loved ones during this surge. As the governor said, the Delta variant is here in Wisconsin and spreading throughout our state. The Delta variant is a whole new game because it is highly contagious, much more contagious than the original strain of COVID-19. Let me give you an example. With the original strain of COVID-19, an infected person was likely to infect 2 other people, who were then likely to infect 2 additional people for a total of 6 cases from 1 infection. With the Delta variant, an infected person is likely to infect 5 people, who are likely to infect 25 people for a total of 30 cases from 1 infection. 6 compared to 30. You can easily see how this variant will spread like wildfire. As the weather changes and more people move indoors, the virus will spread even more rapidly. If you are unvaccinated and exposed, it's not a matter of if you'll get it, it's when. And we know that people who are unvaccinated are most at risk for getting very ill, hospitalized, and dying. With this surge, we're a few weeks behind our southern states. What we're seeing happen in Florida could happen here. Wisconsin has a similar vaccination rate to Florida, and COVID-19 cases are reaching an all-time high in Florida, and their healthcare systems are overwhelmed. We find ourselves in a situation that we hoped was in the past. We risk our hospital systems being overwhelmed again, just as they were last November. I don't want to focus on the doom and gloom, and I want to let you know that we have a way to get through the next couple of months by using the tools in our toolbox to help stop the spread of the Delta virus: masking and physical distancing. We all hoped that we were able to take off our masks for good once we were vaccinated. But because Delta is different, we know that we need to put our masks back on. It's clear why unvaccinated people need to wear masks to prevent infection, but why vaccinated people? Let me use an analogy to explain why. Masks are like a seatbelt on the airplane. You wear your seatbelt for takeoff, and when you hit your cruising altitude, you can take it off and move around the cabin. And if your plane hits a patch of rough air, the pilot asks you to get back to your seat and to put your seatbelt back on. So think about when vaccines first came out. We told everyone to wear masks, even if they were vaccinated, until we could study whether vaccinated people could spread the virus. In May, the evidence showed that vaccinated people were not spreading the virus. So we hit our cruising altitude and we took our masks off. Now, in August, we have encountered some turbulence as we learned that vaccinated people who are infected with the Delta variant can spread it to others. So we need to put our masks back on until we can stabilize disease spread. As the disease changes, we will put our masks on and take them off, just like we put our seatbelts on and take them off when conditions change in flight. This is also why we are urging all schools and school districts to adopt CDC and DHS recommendations to require students and staff to wear masks. Because our youngest students can't be vaccinated, it is the most important action for schools to take to provide a safe learning environment for our kids. And as I've said from the beginning, we need to achieve at least an 80% community vaccination rate. Vaccines are safe and effective, and they will protect you from serious illness, hospitalization, and death. The vaccines work. Please, if you haven't gotten your shot yet, go to vaccines.gov and find a vaccine provider near you. Getting vaccinated is an individual action that has a community impact. and well over 3 million of your fellow Wisconsin residents have taken that step to protect themselves and their community. We're moving in the right direction, but we are also not moving fast enough, and we need more Wisconsinites to choose to get vaccinated and protect themselves and our families and neighbors who are not yet eligible for the vaccine, such as our children. So please get vaccinated. Wear your mask when you're indoors in public, in large gatherings, and most importantly, at school. The COVID-19 vaccines are effective, and getting vaccinated, wearing masks, and following the science will make it possible to protect ourselves and our communities and to move Wisconsin forward. Thank you, and I'll turn it back to Jennifer for your questions.
Thank you, and we will now take your questions. A reminder to maintain audio quality. Please remain muted until it is time to ask your question. If you're able to do so, use *6 to mute and unmute your phone. Also, we need to be out at 2:30, so in the interest of time and to ensure everyone is able to ask a question, we ask that you please limit yourself to one question. And we'll begin this afternoon with Kent Wainscott from WISN-TV in Milwaukee. Kent?
Hi, it's Matt Smith, actually. Governor, wanted to ask you about incentives to get vaccinated. Governor, you said before that everything is on the table. The president, a few weeks ago, encouraged states to give out $100 per vaccination. Other states are seeing success in this. Why hasn't Wisconsin done that yet?
It's still under consideration. We haven't discounted anything, and we will continue to do that. If it seems like it's something logical that we can do to really make a dent, we will do that. But we're still in the decision-making process, and stay tuned.
Thank you. Now to Denise Lockwood from Racine County I. Denise? And a reminder, *6 to unmute your phone. Denise Lockwood, Racine County I. Okay, moving on then to David Wahlberg from the Wisconsin State Journal. David?
Yes, hello, thank you. Governor Evers, do you plan to adopt a COVID-19 vaccine mandate for state workers as other public and private sector employers have done, and why or why not?
We're looking at all alternatives as it relates to our state employees, and we will be making that decision within the next week. Sometime next week, we'll be making that decision. So we're looking at all options. Clearly, as an employer of many thousands of people, we want to make sure that we're doing our part to get shots in arms.
Thank you. Now to Casey Nelson from WTAQ Radio in Green Bay. Casey?
Hi, thanks for taking our questions today. Looking at the death rate right now, 4 more deaths today, but it doesn't seem to be rising quite as quickly as the rest of the cases are. So I guess just kind of the quickest way to ask the question: why aren't death numbers rising quite as high or quickly as normal infections here? Thank you.
Well, I think there's a good answer to that, and that is because if you look at the vaccination rate of people who are most at risk for this disease, those folks who are 65 or older, they have the highest vaccination rate in the state of Wisconsin, somewhere around 90%. So the people who are at highest risk for death from this disease are the best protected. However, we also know that the more disease we have, the more opportunity there is for more people to be hospitalized, to suffer serious consequences from this disease, and also to die. And so I think it's death is not the only indicator of the consequences of COVID-19 that we should look at. We are deeply concerned about younger people who get this disease, who have symptoms of what is called long COVID, that we don't know how long they will live with, that can deeply impact the quality of their lives. And so while younger people may be less likely to die, getting COVID is still a very serious event for them.
Thank you, Casey. Now to Olivia Stern from Up North News. Olivia?
Hi, thank you. What challenges do you foresee or are preparing for when children under 12 who are not able to get vaccinated return to schools with mask optional policies?
Dr. Westergaard?
Sure. As we've learned throughout the pandemic, children are in the age group that is least likely to have severe disease, but we've also learned that children can become infected and spread it to others in their family and to each other at just as high rate as any other age group. So I think this is a critical moment on the topic of masks. You used the word mask optional policy. Really, our recommendation and that of CDC and most state public health departments and local public health departments are for masks to be not optional, but required for all schools, students, and staff when we go back to school. The reason for this is that we are already in a bad position with transmission increasing in the state. And because children are not vaccinated by and large, and they can be in environments where we know transmission can happen explosively in maskless environments, this is really probably one of the biggest priorities, one of the biggest differences we can make in the coming month, is to make sure that when children go back to school, we make those environments as safe as possible. And that includes everyone wearing masks, not just an individual choice, which could protect the wearer, but everyone who might be infected without symptoms and spread it to others. So masks are a tool that work best when everyone in the environment wears them. And so that's really the strong recommendation from public health, is that we make them required in school settings.
Thank you, Olivia. Now to Brian Kernan from Fox 11 in Green Bay. Brian?
Hi there, this is actually Katrina Nickel filling in. My question is, across the state, and especially here in Northeast Wisconsin, we've seen several healthcare workers protesting these vaccine mandates that are being put in place by healthcare systems. Just wondering, Governor Evers, Deputy Secretary Van Dijk, what are your thoughts on these protests and also the healthcare systems mandating the vaccine?
Well, the healthcare institutions are our front lines in this fight against the pandemic. I understand there's going to be. We've been doing this for a year and a half, so there's no misunderstanding on anybody's part that there are people that don't want to be vaccinated. But our healthcare institutions are at the critical point, and I support their decisions. It's important that people that are being taken care of by these institutions, that frankly are the reasons they're in existence, can feel safe. And if they decide to require the masks, I think that's a reasonable thing to do.
And I would just add, healthcare institutions require their staff to be vaccinated for many other illnesses. They must have an annual flu vaccine. They must show immunity against vaccine-preventable diseases like chickenpox and measles and mumps in order to practice in a hospital. And I agree with the governor. It's one of the responsibilities of a healthcare system to create a safe place for patients to be cared for. And it's one of the duties of healthcare providers to be safe in providing that care.
Thank you. Now to Todd Richmond from the Associated Press. Todd? Todd Richmond? We'll try to get back to Todd later on. Moving on now to Alex Moe from WisconsinBusiness.com. Alex?
Hi, thank you for taking my question. I'm wondering if you can provide any information about the length of hospital stays for people being hospitalized with the Delta variant. I'm wondering if the Delta variant is leading to longer hospital stays for patients in Wisconsin as compared to other strains. Thank you.
Dr. Westergaard?
That's not been studied systematically that I'm aware of. I'm happy to look into the published literature and our own data to see if there is any information to answer that question, but I don't believe there is.
Thank you, Alex. Now to Jessica Madikar from TMJ4 in Milwaukee. Jessica. And reminder, *6 to unmute your phone. Jessica Madikar. Moving on then.
Hi.
Oh, go ahead.
Hi there. Can you hear me? This is Jessica from CNBC. Great. I have a question regarding the third booster that, we're beginning to learn about. According to the CDC internal briefing documents, an estimated 1.1 million people have already received their third dose vaccine on their own. Any idea as to when Wisconsin, those that will need the third booster, that will be available? And are there any Wisconsinites in that number?
I don't know about. Do you know about the third boosters?
The third vaccine doses are a topic in the news and the medical literature as well, and there's active discussion. We hear from federal partners that there may be a change in the recommendations about the vaccine schedule related to third doses, possibly very soon. The rationale for this is that some patients with weak immune systems, and this has been best studied in patients with organ transplants, don't have the same level of immune response, which we can measure by the level of COVID-specific antibodies in the blood, as people with strong immune systems. So there's been some recent studies that show when a third dose is given, the immune response can be boosted to a level that is seen in people with healthier immune systems. And then the presumption would then be that those individuals who require a third dose would have similar levels of protection. So this is research and analysis that's still in development. And up until the recommendations change from the ACIP and the FDA, it is not a recommendation. In fact, it's not appropriate for people to get or offer third doses because of the narrow instructions that the emergency use authorization for the vaccines was released with. So that may change in the future. Some people may have gone out and gotten a third dose on their own. There aren't robust systems to prevent people from doing that if they cross state lines, but our official recommendation and the rules and regulations are that until the federal guidance about the vaccine schedules changes, that 2 doses is a full series. And that's still the case at this moment, pending any changes from the federal level.
Thank you. Now to Sean Kirkby from Wisconsin Health News. Sean?
Hi, thanks for holding this. Governor Evers, are you considering requiring healthcare workers and school staff to get COVID-19 vaccine like California has? Thanks.
We right at this point in time, and it's playing out right in front of our eyes. Healthcare workers, healthcare institutions, as I mentioned in one of the previous questions, many of them are already requiring that, and as an employers, that is the place where I believe those decisions should be made. And you've heard two people now talking about what the expectations are for schools, the highly recommended expectations, and local school boards are wrestling with that as we speak.
Also add too, in terms of the state doing mandates or requirements, there's significantly fewer tools available because of the Supreme Court and legislative Republicans filing lawsuits over the last year and a half. So there simply are fewer tools available to implement mitigation measures like that.
Thank you. Now to Gabriella Rusk from NBC 15 in Madison. Gabriella?
Hello. My question regards variant sequencing. Right now, many of the state labs are doing the sequencing on the Delta variant, but it's a very small number considering the cases. As the cases begin to increase, is it anticipated that more of those viral strains will be sequenced and tested to see if they are in fact the Delta variant?
Tell you about genomic sequencing is it is a surveillance tool. It is not a diagnostic tool. And so we are building the capacity to do even more genomic sequencing so that we continue to understand the evolution of the virus. We can, frankly, we don't need to sequence a whole lot more samples to understand that the Delta variant is here. It is very clear from the surveillance we have done that it is here. And based on what we've already talked about, it is very clear that based on the number of cases we have, that it is spreading widely throughout our state. I would say the most important thing about genomic sequencing as we move forward is for our laboratory partners to continue to look at the genetic composition of this virus so that they can quickly identify if it has changed again, so that we can monitor for other consequences of a new variant. You know, our biggest fear is a new variant could be resistant to vaccine, resistant to treatments, even more infectious or virulent, causing more serious disease than Delta does. And so our laboratorians are really our detectives on this, helping monitor for what's next.
Thank you, Gabriella. Now to ERIK GUNN from Wisconsin Examiner. ERIK? And ERIK GUNN from Wisconsin Examiner. And moving on then to Rhonda Fox from WTAQ.
Hello. Sorry, it took me a minute there.
Go ahead.
Yeah, in some parts of the country, there's been a sharp increase in the number of children who are being hospitalized, and reflecting their greater vulnerability if they're not able to be vaccinated, for instance. I'm wondering if you're seeing that in the data here as well, and if it is not showing up yet, is there some concern that that might happen? Thank you.
Dr. Westergaard?
Yes. I think the first thing to say is to set the stage is that we are in an unusual environment with respect to infections in children generally, independent of the Delta surge of COVID. We've had increases in hospitalizations among children for respiratory viruses other than COVID-19 for a couple of months now, and that's actually very concerning. We're typically seeing infections like RSV and parainfluenza in the winter months. It's highly unusual to see large surges of those in the summer, but that is in fact what we're seeing. So in Wisconsin and other places, that has actually led to pediatric intensive care units being much fuller than they typically are at this time of year. So the big concern is that as infections of COVID-19 increase across the board, that could very well translate to higher numbers of children being hospitalized on top of this already interesting and unusual surge in non-COVID respiratory infections. So it actually adds some urgency to the precautions we must take to prevent transmission from reaching our schools and other settings where our young people are, because our hospital resources to take care of critically ill children are finite. And the potential surge that could affect school-age children could cause a lot of trouble in not having enough resources to care for children who need critical care in our hospitals.
Thank you. Now to Rhonda Fox from WKOW-TV in Madison. Rhonda.
Hi, this is just a follow-up to a previous reporter question. Are there any, it's the question about the 1.1 million people that received the third dose. Were any Wisconsinites in that 1.1 million?
Yeah, it's hard to say from our data. No one should be given a third dose if we know they've had the first two doses. We have seen some incidents of people knowing that, and so they live on a state line and they go across the state line to get a third dose, and then it takes a while for records, for example, from Minnesota and Wisconsin to get merged to track that. So yes, it is possible that there are Wisconsinites who have sought and successfully received a third dose, but we have been very focused on working with our vaccinators to be sure they understand the guidance of the emergency use authorization and CDC, that is not allowed under the current regulations and based on the current contract they have signed in order to be a vaccinator.
Thank you, Ron.
I think I'd add one point to that. I may not have sufficiently emphasized before. As that may change, if third doses become authorized for additional patients, it's likely to be very limited in scope to patients with certain conditions that give them a weaker immune system. And people who have received organ transplantations is probably the most likely example of those. It's not likely that's going to be changing wholesale, where third doses or booster doses are recommended for everybody. I think that's unlikely to happen soon. This virus is going to be with us for a long time, and things will evolve over time. But I think the message for today about third doses is that right now it's not appropriate or recommended in any settings. It might change for a limited number of patients who have specific conditions related to their immune system in the near future, and anything beyond that, we need to be driven by future research and data as it becomes available.
Thank you. Now to Joshua Pagero from WBAY-TV in Green Bay. Joshua.
Thank you so much for taking my call. Governor, this is a question to you. I know it was just, you are encouraging school districts to follow CDC and DHS recommendations on masking options. But what do you say to some of these school districts who are receiving crazy pushback from some, conservative right-wing groups who are somehow infiltrating these local school board meetings and causing a ruckus? I mean, I've been a part of some of those meetings, and it seems like, it's instilled this sort of fear among some board members to adopt some mask mandates. Do you have any take on that?
Yeah, it has never been more difficult to be a school board member in the state of Wisconsin during the pandemic, and in addition to right now, as we're hopefully are starting the process of ending the pandemic. I know school board members have to be responsive to the people that elect them and to put them in charge of kids' education. But at the same time, they also have some obligations around following the science, and the science certainly indicates that mask wearing in schools would be highly recommended. And so my pitch is the same as the new state superintendent's pitch, and that is the recommendations are high. It is highly recommended that masks be worn in schools. And I know the final call is at the local level at this time, but it's not that I'm sitting here saying I feel their pain, but because I'm not a school board member, but it is really critical for them to make sure that kids are safe, and I know that's important.
Thank you, Josh. Now to Katrina Lim from WQOW-TV in Eau Claire. Katrina. WQOW-TV. And a reminder, *6 will unmute your phone. And we have to move on then to Caroline Hogan from NBC 26. Caroline?
Hi, yes. I would like to know specifically more about the demographics in the hospitalizations that we're seeing. Are we seeing, I know you spoke earlier about how a lot of the people that we're seeing hospitalized right now are unvaccinated. However, are we seeing more of the older population, elderly per se, that were more immunocompromised towards the beginning of the pandemic, or are we seeing more children?
Dr. Westergaard, do you have any data around the demographics?
We can potentially get those data for you. So these are obviously, we agree, very important trends to keep track of. Hospitals report data to us on a daily basis among how many people have been admitted. So we get that in relatively real time. The investigation about individual characteristics, about age and gender and race and ethnicity take a little bit more effort through our surveillance system to compile. So we don't report that stuff in real time on our website, but we agree it's important and can be happy to work with you and follow up to get some of those breakdown. But we don't have those specific numbers handy for you.
Thank you, Caroline. Now to Bill Miston from Fox 6 in Milwaukee. Bill?
This is maybe more of a question for Jen Dijk or Dr. Westergaard. But Governor Evers, please feel free to share your thoughts. Obviously, the UW system is getting ready for the start of the school year. A number of students are coming into university housing, but housing is not collecting COVID-19 vaccine information from contract holders. Is there concern that there aren't plans in place with the UW system for students who are vaccinated who are being housed with those that are refusing to get vaccines, and that there isn't much recourse for those students who want to be safe and making prudent public health decisions for them to find another place to live?
Well, I think one of the things that's very important here is that the university is also following the science, and they have been paying close attention and using that to guide their decisions and their recommendations, including many campuses moving to mask requirements, assessing their need for testing. And the university did a fabulous job last year of, after an initial surge of infections, deploying an aggressive testing program coupled with isolation and quarantine. Testing alone doesn't stop the spread of COVID. It's testing along with isolation and quarantine that actually stops the spread. In terms of the specific question of collecting that vaccine data, frankly, one of the things that happens when you go to college is you learn to live with a roommate, and all of the personalities and effects of being with another person. And so this decision about vaccination and not vaccination is something that roommates have to work out with each other. And I would trust the university as a robust housing system to help assist when there are disagreements in those specific situations. But I applaud the university and the work they're doing to promote vaccine, to promote mask wearing, and to promote testing coupled with isolation and quarantine.
Thank you, Bill. Now to Maddie Heim from the Appleton Post-Crescent. Maddie?
Hi, thank you. Governor Evers, I know things have changed in the legal landscape since last year at this time, but I do just have to ask, as cases continue to grow and if we continue to head in the wrong direction, would you issue another mask mandate?
Well, first of all, I know everybody wants to know the end game here, but the precursor to that end game is to have people be vaccinated. And so our focus right now is on making sure that those people that have been reluctant in the past or maybe even forgot about that they haven't had a shot, to make sure that that happens. And I'm hopeful that everybody else around the state understands the severity of this. So of course the legislature and also the Supreme Court made some decisions, but at the end of the day, we will be following the science.
Thank you, Maddie. Now to Madeline Fox from Wisconsin Public Radio. Madeline?
Hi there. I have kind of a two-part question about kids and vaccination. First of all, we're seeing a lower rate of vaccination in the eligible kids and teens in Wisconsin than adults. And I was wondering if you had thoughts on why that is. And I am similarly worried, the misinformation, the politicization of COVID has definitely sort of fanned the flames of anti-vaccine sentiment. And I was wondering if you have concerns that might spill over into the uptake of other vaccines, like MMR or Tdap, or these ones that kids traditionally get to go to school.
Well, we are seeing delays in vaccination rates of other diseases like MMR and diphtheria, pertussis, and tetanus. I'm not ready to call it anti-vaxxing. I think it's largely because healthcare was disrupted during the pandemic and children missed child appointments and missed getting their vaccines. So it's really important. Again, as Dr. Westergaard said, we need to keep our healthcare system open for everybody who needs healthcare beyond COVID. And that is another reason we all need to get vaccinated, and we need to mask up right now to curb the spread of this so that we preserve access to our healthcare system for kids to get their vaccines, for other emergencies. That is all incredibly important. In terms of why children are lagging, a couple of things. First of all, they've had less time. They were not eligible for vaccine until May, whereas many others were eligible in January, February, March. And parents are still learning more about this vaccine and may have further worries about their children. The other thing that I hear quite frequently about teenage girls in particular is the myth that COVID vaccine affects your fertility seems to have caught fire, and young women have said to me that's what they are worried about. And I think it's very important. They don't believe a story on the internet, on Facebook, but they go and talk with their doctor, their nurse practitioner, and get information about that concern. It's a valid concern to want to have children, but I can assure you the vaccines are not affecting fertility. I've encouraged my daughters to have those vaccines. I would like to have more grandchildren, and if I thought there was any risk of that, I wouldn't have done that. But the risk of COVID is far higher, and we want our young women protected as well as our young men.
Thank you. Now to Seeger Gray from WORT Radio in Madison. Seeger?
Thank you. My question was already asked and answered.
Okay, thank you. And our final question today belongs to Adam Duxter from News 3 in Madison. Adam.
Hi, guys. You can hear me all right?
Yes, we can.
Okay, I wanted to ask, kind of in line with what some of the other folks have asked about vaccines for children. As UW Health launches their Moderna vaccine trial here for kids, it's looking like we could have a vaccine approved for school-age students by the end of the calendar year. And if that is the case and they drop the emergency use, do you think that you could see schools requiring a COVID vaccine the same way they do require Hep B or MMR or another type of vaccine for their students?
Well, the vaccines that you have mentioned that are required for school entrance are a state administrative rule, and we would have to explore that and study that, and it does take some time to institute a new administrative rule. So through a state process, that will not happen this school year. Whether a school district on their own their school board can make a requirement for vaccination, I would leave that to the local school boards to decide in consultation with their legal resources. But at a state level, the process to add a vaccine to our state administrative rule does take a bit of time and would not be possible to happen yet this school year.
Thank you. And before we conclude, there were a couple of reporters we didn't get to before, and we'll try again for Todd Richmond from the Associated Press. Todd, are you there?
Hi, no questions today, thanks.
Okay, thank you. And also Katrina Lim from WQOW-TV in Eau Claire. Katrina? All right, and with that, that concludes today's briefing. Thank you to Governor Evers, Deputy Secretary Julie Willems Van Dijk, Dr. Westergaard, and Ryan Nilsestuen, and all of you for participating. We will schedule our next briefing as needed. In the meantime, we ask you to continue to monitor the DHS COVID-19 web pages for data and guidance. Additional information can be found on the websites of the Governor, the Department of Workforce Development, the Department of Public Instruction, the Department of Children and Families, and Wisconsin Emergency Management. Be safe and have a great afternoon.
This program is a production of Wisconsin Eye, an independent, nonpartisan, nonprofit media network with a mission to inform, educate, and engage the citizens of Wisconsin. Wisconsin Eye is the nation's first and only independently funded state civics broadcast network, providing gavel-to-gavel access to government proceedings and events at the state capitol.